Hi, everybody. My name is Jennifer Mills, and I'm a medical laboratory scientist and phlebotomist. Today, I'll be talking about population health in Nebraska, which is my current state. Okay, so here you can see a chart that kind of gives you an overview of what they found in the study. The study was conducted by United Health Foundation and is titled the 2024 Senior Report. It's a comprehensive overview of the health and well-being of the nation's older adults, 65 and older, based on certain health metrics and health outcomes. You can see that pretty much every health outcome rose negatively. Drug deaths, frequent mental distress, depression, poverty, food insecurity, firearm deaths, housing cost burden, and lastly, early deaths did not rise, but we'll get into that in the next slide, why it didn't rise. And all these metrics rose even though we've had an increase of geriatric clinicians, access to more doctors, and an increase, albeit small, in access to high-speed internet, and a decrease in negative oral health care that would include teeth extraction. So despite these good things that we're seeing, some of our metrics still have negative outcomes. Okay, so I thought it would be important to talk about why we still see a decline in early deaths, even though we have such negative outcomes for some of these health metrics. And that's because of outliers. Honestly, in medical laboratory science, we usually take outliers out before we make our metrics so that our metrics don't inaccurately describe something to the doctor that's not necessarily true. An example of this would be if we're measuring glucose readings in the Panhandle of Nebraska, and everybody's reading at between 110 to 120 grams per deciliter for glucose in the blood. But then we've got three guys that are really, really low at 90. We would probably take those three outliers out so that when we're making our data metrics for the analyzer, we don't get an inaccurate description of metrics. So as you can see here in this chart that is part of the report, the outliers are Asian and multiracial cultures and ethnicity. So they're kind of skewing those results. Had those two been left out, we would have actually seen a rise in early deaths in our older community. And you can see there with the Black American, Indian, Alaskan, Native American, Hawaiian, Pacific Islander, white and Hispanic ethnicities actually all sit pretty high in early death statistics. That brings me to why I think that early deaths are happening for our older community. And I wanted to focus on social isolation. It doesn't get enough attention in our healthcare environment. And there was a lot of great data that this report included for social isolation, including information and data for the state of Nebraska. So I thought that was kind of cool. So I wanted to talk about it a little bit. This is the map they included for all 50 states. Okay, and you can kind of see the darker the areas, the more isolated these folks are, right? And then the lighter areas, the less isolated they feel, that they report that they feel in 65 and older communities. So I don't know if you can, since there's no state lines drawn, you can kind of see that light area there towards the left of the map. That's Utah. Okay, a little bit north of Utah, you're going to see Idaho, and to the northeast, you'll see Wyoming, and right beneath Wyoming, you'll see parts of Colorado are kind of light colored. So we're talking Utah, Wyoming, and Colorado as being the least socially isolated states in the country, and you can probably see it's not too horrible over there in the Great Lakes area. It could be better, but overall, the best state is clearly Utah for the lack of social isolation. Social isolation is the lack of social contacts and having few people to interact with regularly. So a little different than loneliness. Social isolation literally has to do with how many people you talk to or interact with. So why did I choose social isolation? It did seem to be the cause of the early death scenario. And that's because you can see from the report, you'll have to review it later. I've included links for that. Social isolation, according to the report, is associated with high blood pressure, heart disease, obesity, weak immune function, anxiety, depression, cognitive decline, that includes dementia and Alzheimer's, and ultimately death was included as an association of social isolation. So how does social isolation look in the state of Nebraska? How does this data reflect in my state for early death rates? Well, factors that affect my community, which is clear over on the wrong side of Nebraska, on the left side, I like to call it the not Lincoln, Omaha side, is over there in the left side corner called the Panhandle of Nebraska. I live in a community called Scottsbluff County. So it's 3 counties up from the bottom. So that medium blue colored square, the smaller square, that's Scottsbluff County. If you look clear over to the other side of the state, areas like Lincoln and Omaha, there to the far right, they're doing okay. It's not perfect, but they're doing a lot better than maybe Scottsbluff County, and we'll kind of talk about why in a moment. Factors that affect my community in Nebraska, and I have to talk about just my area because, as you can see, Nebraska is all over the place. We have some areas where they report they don't feel socially isolated at all. So this is definitely a hodgepodge of social factors based on community factors, period. So I thought that was really, really interesting that it could be so different throughout the entire state of what people are reporting and feeling. So in my community, we found that loss of mobility, vision hearing problems, psychological cognitive challenges, lack of purpose, financial struggles, living alone, lack of transportation. We do not have a bus system in Scottsbluff, Nebraska. None. We also do not have a transportation system for the elderly at all. It's a rural community. We don't have bus systems here. And major life changes such as the death of a spouse, lack of social support. A lot of us find ourselves caring for a loved one who's unwell, like our spouse, because we don't have access to in-home care. We don't have access to those funds. A lot of these folks are on Medicare only and Social Security, so that they spend the rest of their golden years taking care of someone else and not socializing. And then just ultimately living in a rural, hard-to-reach neighborhood causes social isolation. And I do want to throw in the weather. So 5 months out of the year, you don't want to go walking around outside, especially if you're 65 and older, to get to your car, drive on the icy roads, and to get to somebody else's house or some social event. So there's a lot of factors that go into why I think Scottsbluff County is so high in the social isolation risk category. Okay, so now that I've complained about it, how do we overcome it, right? How do we overcome social isolation? Well, younger folks seem to be a little bit better about doing that, but older folks have a harder time getting around this, especially when you're facing things like the weather or being the primary caretaker for your spouse or having financial troubles. But according to the National Institute on Aging, there are some things that we could do here in our community, and they would include picking up a new hobby and joining a group. So we don't have a whole lot of groups or access to that kind of thing in a small rural town, but they do exist. So places like the YMCA, church organizations, we have volunteer services at daycares, schools. We also have the Humane Society is a great place to volunteer. So we do have a little bit that they could get more active and involved with. Scheduling a regular time to call family, that's a very important part of staying away from social isolation. So you don't want to be calling your family all day, every day, feel like a burden, but you do need to say to yourself, okay, well, every Sunday morning I'm going to call my son. And then every Wednesday I'm going to call my granddaughter. That way your family can make time for you and kind of expect when they need to spend time with an older person, 65 and older. Something else they recommend is learning how to use video calls. And I know technology and older people do not go hand in hand well together, but every library does have services that will help train you on how to use a computer for free and how to use some of this technology, which is another suggestion that the National Institute on Aging has included in overcoming social isolation. So using that library, using that technology, adopting a pet, that's huge. So having a small manageable pet, a cat, small dog, seems to really improve social isolation. Exercising at your local gym, joining a workout group. We do have gyms. We have gyms aplenty, even in Scottsbluff, Nebraska. That is an option. Um, Getting to that gym will be a challenge until we address a bus system that can help older people get around. We don't want them driving if they're not able to drive. We want to give them resources to do that. So that's also going to have to be a community effort. And again, you can always join faith-based organizations. If you're not a Christian, that's okay. There's other faith-based facilities, even in Scottsbluff, Nebraska, that you can join. You can get involved in the community. So we have parades, we have vendors we set up, we have the Oregon Trail Days, chili cook-offs. We have all kinds of stuff going on, but you need to have access to high-speed internet so you can get on Facebook, get on Instagram, see what's going on in the community. Okay, so earlier I had mentioned Utah. That was actually the state that was ranked the healthiest across most parameters that the 2024 senior report had found. And one of those areas that were assessed was the social isolation area. And this is what the map looks like for the counties in Utah. A lot different than Nebraska. A lot different. So even though they have multiple counties, probably not as many as I'd say Nebraska, um, all of them are kind of unanimous in feeling not socially isolated. So how do we be like Utah? How does Nebraska be like Utah? Well, probably following some of those things from our last slide. And then kind of staying active in your community. One thing that the report found was that Utah had the highest percent of employers who provide insurance and lower annual premium costs. That doesn't really help disabled or elderly community who might be on Social Security, but it does kind of set the stage, right? So these people had better access to healthcare before they turned 65. So we're talking a lot of preventative healthcare measures prior to retirement age. Probably is a huge factor. But the study also identified a couple of other things. Utah is number 2 in social and economic factors. Number 2 out of all 50 states. I think number 1 was Rhode Island. So what does that mean? Social and economic factors. So socially, Utah's ranking number 2. They feel not socially isolated. That's the biggest reason overall that the study found that Utah is considered the healthiest state in the United States right now. They were also ranked number 14 in physical environment. So not as great as number 2, right? But remember, this is out of 50 states. They were number 10 in clinical care, number 14 in overall health outcomes, and interestingly, number 4, which is pretty high up, in behaviors. So we're getting out of this behavior and social isolation are both the main factors in what made Utah the healthiest state in the United States. So just kind of fun information there. Okay, well, thanks for listening. I hope you learned something. Here's my references in case you want to check them out. It was the mostly information from the 2024 senior report done by the America's Health Rankings organization, and then a little bit of research into loneliness and social isolation.